CJSW 90.9 FM is proud to present our 2025 federal election coverage. CJSW radio broadcasts out of the University of Calgary campus located in Calgary, Alberta, and we would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta. The City of Calgary is also home to the Métis Nation of Alberta, Districts 5 and 6.
My name is Kamal Karimi, and in this episode, we'll be highlighting how political parties in Canada will approach healthcare if elected into power. These policies and commitments have been taken from the political platforms released by each of the parties with official party status in the House of Commons, namely the Liberal Party, Conservative Party, New Democratic Party, referred to as the NDP going forward, and the Bloc Québécois, referred to as the Bloc going forward. We'll move through major talking points within the topic and how each party addresses points within them. If a specific point doesn't appear alongside the other parties mentioned, it's because we were unable to find anything within their platforms to add. We may not be able to cover each of the platforms in the fine detail they go into, so we've linked the platforms within the description of each of these episodes. We encourage people to take time to read through the platforms, but you can keep listening to hear about some of the major points in regards to healthcare. Topic 1. Improving health services. Canada's healthcare system is said to be in a crisis, with extended wait times for patients and lack of access to professional care being just two of the major concerns for Canadians. How will each party address these concerns and others? According to the Liberal Party's platform, they plan on adding thousands of new doctors to Canada's healthcare system by working with provinces, territories, and Indigenous peoples to increase medical school and residency spaces and build new medical schools and expand residency positions, especially for family medicine. They say this will be done in close collaboration with each province and territory to reflect their priorities and population needs. They also say they want to make it easier for internationally trained doctors and health professionals to practice in Canada, address labor mobility issues, and implement pan-Canadian licensure so that healthcare workers can be employed anywhere in Canada, and recruit qualified doctors through a new global recruitment strategy that will fast-track the arrival of doctors into Canada, including Canadians practicing abroad and other U.S.-trained physicians and health researchers. On top of their plans to add more doctors, they lay out their plans to make it easier to set up clinics in new communities through a new practice fund to help family doctors with the costs of opening a practice, such as new clinic space and medical equipment and technologies. They also want to build hospitals, clinics, and more by investing $4 billion to construct and renovate community healthcare infrastructure. They want to provide personal support workers, or PSWs for short, with up to $1,100 a year by immediately legislating a refundable healthcare workers' hero tax credit. They want to support training for nurses, PSWs, and teachers by expanding the Union Training and Innovation Program, or UTIP for short, to include training spaces. They also promise to protect and permanently fund the Sexual and Reproductive Health Fund. The Conservative Party's platforms say that they will honor current federal health transfer agreements to fund the health care all Canadians deserve, preserve existing dental care coverage, and honor existing deals with provinces and territories on childcare and pharmacare. They also plan to launch a Blue Seal program to help Canadians and newcomers get to work faster by working with provinces to create nationally recognized licenses for doctors, nurses, early childhood educators, and other professions, providing small loans to help new Canadians complete Blue Seal certification, bringing home Canadian students studying medicine abroad by expanding residency spots for them here where they want to work in our healthcare system, rapidly recognizing U.S. board certified professionals to bring more qualified physicians to meet Canadians' healthcare needs, as well as adding 15,000 doctors by the year 2030. Additionally, they say that they will protect healthcare access and values by upholding the Canadian Health Act and defending universal public health care, maintaining the party's 21-year-old policy that a, quote, conservative government will not support any legislation to regulate abortion. There will be no laws, rules, or regulations passed restricting abortion, according to their platform. The party platform for the Bloc Québécois is written entirely in French, with no English version available. We've done our best to translate the platform and share the pertinent points within these episodes. According to our translation of the platform, the Bloc Québécois is aiming to increase federal health transfers to 35% of total costs to address the ongoing crisis in our public healthcare system. Additionally, the Bloc Québécois will call for the transfer of the federal dental care program to Quebec, which will save money by entrusting management to RAMQ rather than a private insurer, while also allowing for an adjustment of fee schedules so that they truly reflect the cost billed to patients, in their words. The New Democratic Party, or NDP party, has a lot in their platform about healthcare. They say that they will guarantee that every Canadian can access primary care and a family doctor by 2030 by putting in place a strategy that retains and hires more doctors, nurses, and other healthcare workers. They say that they will help tackle the doctor shortage, and they will boost Canadian health transfers by an additional 1% for provinces that commit to action and publicly report on their progress. Their platform says that they'll take tangible steps to help connect every Canadian with a family doctor, including creating residencies for qualified, internationally trained doctors already living in Canada, implementing a pan-Canadian licensure to help medical professionals practice where they are needed across the country, working with provinces and doctors to reduce what they call burdensome administrative bureaucracy imposed on medical practitioners that takes time away from patients, training and equipping more doctors from northern and rural communities, as well as working with territorial governments to provide housing and facilities for family doctors and primary care teams to keep healthcare providers in the north. Alongside those steps to connect Canadians with family doctors, they say that they'll work with Canada's nurses to close the job vacancy gap in the nursing sector to ensure wage parity and safe staffing ratios. They'll put in place a $5,000 tax credit to help boost pay for more than 780,000 nurses and personal support workers. During the first year of the next parliament, they say that they will get deals with every province to cover diabetes medications and birth control. Finally, they say that they'll expand that first step by covering essential medicines by the end of the first year, building to full coverage by the end of 4 years. Major policy number 2, mental health and addiction treatment. Mental health and addiction are two health concerns that affect Canadians on a daily basis, directly and indirectly. Many feel that Canadian healthcare systems should be better equipped for the treatments that are necessary for managing patients with mental health disorders, as well as those who may be dealing with drug or narcotic addiction. Here's how the parties plan on addressing these concerns. The Liberal Party's platforms say that they'll provide 100,000 young people a year with mental health care by establishing a permanent youth mental health fund. They say that they'll provide urgent and immediate support to address the overdose crisis by adding $500 million to the Emergency Treatment Fund to support municipalities, Indigenous peoples, and community healthcare organizations in order to confront the toxic drug and overdose crisis and connect more people to treatment and vital services faster. They also promise to invest in deeply affordable housing, supportive housing, and shelters in recognition of the link between housing and mental health outcomes. Finally, they promise to continue to fund the 988 Suicide Crisis Helpline. The Conservative Party's platform outlines their plans around mental health and addiction treatment as well. According to their platform, they say that they'll bring our loved ones home drug-free by helping 50,000 Canadians recover from addiction. They plan on banning drug dens within 500 meters of schools, parks, and seniors' homes, and imposing strict new oversight rules to ensure that there are pathways to treatment and recovery. According to their platform and in their own words, they also say that they'll end the failed Liberal so-called safe supply experiment that has flooded streets with taxpayer-funded addictive opioids, keeping people hooked instead of helping them heal. They also plan on distributing 300,000 nasal naloxone kits to save lives and stop overdoses. They plan on creating a national outcomes dashboard to ensure transparency of data and allow provinces to track best practices. They plan on using compassionate intervention, allowing judges to sentence offenders to mandatory treatment for addiction to help people struggling with severe addictions. They also say that they'll safely speed up drug approval for drugs approved by 2 of 3 peer jurisdictions, ensure companies share all data on pediatric drug use, and implement a rare diseases strategy to support treatment development. Finally, they say that they'll launch a $44 billion lawsuit against Big Pharma to pay for addiction treatment and recovery. According to our translation of the Bloc Party's platform, they say that the fentanyl crisis is first and foremost a public health crisis. They maintain that a massive increase in health funding through federal transfers is the only way to improve the deficient provision of mental health care, rehabilitation center spaces, rapid access to emergency care, social workers, supervised consumption sites, and harm reduction. They also say that border measures against organized crime remain necessary in collaboration with the U.S. and Mexican authorities. The NDP's platform say that as a tangible step to expanding mental health coverage, they'll ensure that all Canadians can access services like psychotherapy and counseling by launching a new plan to cover these services for those who are currently not covered by work plans. They say that they'll expand funding for crisis and addictions care to help people access the care that they need. As we mentioned at the beginning of the episode, there may be more policies and points made within each of the party's platforms, so we encourage you to go find those and read through them, which you can find linked within the description of this episode. Thank you for listening to this episode focusing on how major federal parties plan on addressing healthcare concerns.
You're tuned in to CJSW 90.9 FM's 2025 federal election coverage. To listen back to full episodes, please visit cjsw.com or download the CJSW mobile app available for iPhone and Android.